Veramarx has developed the first accurate early-stage Lyme disease test. It's a traditional blood test. It doesn't change the physician's behavior. It doesn't change the patient's behavior. It gives the physician 99% certainty that a negative is a true negative. We have 92% sensitivity. Our results are given back to the physician within 48 hours. What Veramarx does differently than the current two-tiered testing system recommended by the CDC is that we measure inflammatory markers that are upstream from antibodies. The current tests are measuring antibody production, which means that you either have to wait for antibodies to be produced, or more importantly, one of the main issues with Lyme disease is that antibodies may not be produced at all, or they may be blocked from production or be produced too weakly to be measured. So doctors can have confidence for the first time with the Veramarx Lyme disease test that they can rule it out. We have 99% negative predictive value, which means that the doctor has 99% certainty that a negative from our test is a true negative.
So we have validated the test in a clinical study that we performed at National Jewish Health. And we were able to demonstrate over 90% sensitivity. We actually showed 92% sensitivity and a negative predictive value of 99% with this test. And these were all on first presentation of symptom samples. So at the very earliest stage, at the point where a patient would first present symptoms to a physician, we were able to pick up the infection with 92% sensitivity and rule out Lyme disease with 99% certainty. And that's really what the physicians are missing today, is that negative predictive value. When they get a negative result, which they most often do, they really have no way to know if it's really a negative result with a 60% false negative rate. So that giving them that certainty around the negatives is critical for them to not miss cases. And when they get a negative and they withhold treatment, they can be sure that they're doing the right thing for the patient.